Nagpositibo sa isang uri ng coronavirus ang isang batang Chinese na nagpunta sa Cebu galing Wuhan, China, kung saan unang naitala ang bagong uri ng coronavirus na sinasabing kahalintulad ng SARS o ng Severe Acute Respiratory Syndrome. Pero hindi pa nakukumpirma kung tinamaan nga ang bata ng bagong strain ng coronavirus na tinatawag ngayong 2019 Novel Coronavirus o nCoV. Sa gitna ng patuloy na pagdami ng mga tinatamaan nito, tiniyak ng ating Department of Health na nakahanda sila sakaling makapasok na rin sa Pilipinas ang sakit. May report si Ivan Mayrina.
Patuloy na tinututukan ng Department of Health ang isang batang Chinese na 5 taong gulang sa Regional Epidemiology and Surveillance Unit ng DOH. Isinailalim sa test ang ilang sample mula sa bata sa Research Institute for Tropical Medicine o RITM. Negatibo ito sa dati ng kumalat na SARS at MERS-CoV, pero positibo ito sa isang uri ng coronavirus. Ayon sa DOH, may 6 na strain ng coronavirus na nakakaapekto sa tao.
The samples tested positive for non-specific pan-coronavirus assay. Thus, the specimen has been sent to Australia to identify the specific coronavirus strain.
Hindi pa natin alam kung anong strain of the 6, pero alam natin sigurado tayo na hindi siya SARS at hindi siya MERS-CoV. So it can be one of the 4 na hindi pa natin alam, or it can be a totally new strain of virus.
Inuubo at naka-isolate pa raw ang bata. May lagnat, inuubo at masakit na lalamunan nang dumating ang bata sa Cebu nitong January 12. Galing siya sa Wuhan, China, kung saan nagmula ang isang bagong strain ng coronavirus. Base sa latest na datos ng World Health Organization, may 222 na kumpirmadong kaso ng tinatawag ngayong 2019 Novel Coronavirus o nCoV. Karamihan mula sa Wuhan, China, pero may mga kumpirmado na rin kaso sa Thailand, Japan at South Korea. Lumalabas sa mga naitatalang kaso na hindi lamang ito nakukuha sa mga hayop, kundi naililipat din ng tao sa tao. Pero kung gaano ito kabagsik, hindi pa malinaw ayon sa WHO. May 4 na kaso nang namatay pero 3 sa kanila may iba pang iniindang sakit bago tamaan ng nCoV. Ang DOH, sinigurong hindi naman bago sa atin ang mga ganitong uri ng sakit at kayang harapin sakaling makapasok sa ating bansa.
Too early now to say that it is a very severe infection that causes death, right? We are in the early stages of trying to understand how severe this infection is and how many deaths is it likely to cause.
From our experience in MERS-CoV, there have been protocols prepared. We just had to modify them a bit to the novel coronavirus. In those protocols, we have guidelines.
Sa kabila niyan, wala naman daw travel restriction. Bago ang kaso ng bata sa Cebu na itinuturing ngayong person under investigation, 3 Chinese national din na lumapag sa Kalibo, Aklan ang sinuri na may sintomas ng trangkaso. Tinetest pa ang throat samples na nakuha mula sa kanila pero wala na silang sakit sa ngayon. Paalala naman ng DOH at WHO habang patuloy pang kumakalat ng karagdagang impormasyon tungkol sa sinasabing bagong coronavirus strain, panatilihing malinis ang katawan.
Patient as of today is still experiencing cough but is currently stable and afebrile. Samples from the patient were first tested at the Research Institute for Tropical Medicine or RITM and yielded negative results for the Middle Eastern Respiratory Syndrome related coronavirus, or more often referred to as MERS-CoV, and Severe Acute Respiratory Syndrome related coronavirus or SARS-CoV. Both are negative. However, the samples tested positive for non-specific pan-coronavirus assay. Thus, the specimen has been sent to Australia to identify the specific coronavirus strain. Is also closely monitoring individuals who manifested signs of respiratory infection and had a history of travel to China, and is coordinating with the WHO and China Center for Disease Control for updates.
Coronaviruses are a large family of viruses to which MERS-CoV belongs and may cause a range of illnesses to humans and animals, from the common cold to severe acute respiratory infection. The means of transmission is not yet fully understood, but some evidence indicate the following: droplets from the patient during sneezing or coughing, touching the patient's stuff or surfaces and objects contaminated with the virus, direct contact with the infected person, the possibility of transmission from infected animals. The main signs and symptoms for corona infection are fever, cough, sore throat, shortness of breath, and in some cases, diarrhea and vomiting. Some cases with low immunity may develop renal or respiratory failure and even death. Patients are provided with the supportive treatment based on the patient's clinical condition, which might include antipyretics, fluids, oxygen, antibiotics, and others. Vaccine is in the research phase so far. For your protection, you should follow this advice. Wash your hands well and continually with water and soap or with other disinfectants, especially after coughing, sneezing, and using toilets. Use a handkerchief when coughing or sneezing and cover your mouth and nose with it. Then get rid of the handkerchief in a wastebasket. Try as much as possible to avoid touching the eyes, nose, and mouth. Put on face masks if you're sick, visiting sick patients, or when traveling to crowded places. Keep performing the other hygienic habits such as balanced diet and physical activity, and sleep well. Wash vegetables and fruits well before consuming. Avoid as much as possible contact with infected people or using their personal belongings. Cook meat thoroughly and boil milk well, especially Camel's one. People infected with diabetes, renal failure, chronic lung disease, and immunodeficiency should avoid contact with camels. Camel farm and slaughterhouse workers should have facial protection and frequent hand washing after touching animals, especially calves. Elderly patients with chronic diseases or those who are in close contact with camels are urged to visit the nearest health center immediately if they develop symptoms of acute respiratory infection.
And people who have signs of respiratory infections, even if it's a common cold, should practice some degree of social etiquette, distancing, avoid crowded places, so that they minimize the risk of infecting other people. Right now the numbers are very small, they are largely concentrated in China, right? Do you have travel history coming from China? So we are now broadening if you're looking at a risk analysis, right? But without that evidence, there is no need to unnecessarily get anxious and ask for coronavirus tests for everybody who is exhibiting respiratory symptoms.